As hospitals across the province continue to deal with unprecedented staffing shortages, the health minister wouldn't rule out more privatization to try and fix the crisis. Sylvia Jones says all options are on the table, prompting an outcry from opposition leaders. Matt Ingram has more.
Asked multiple times if the government was looking at more privatization in the healthcare system, the health minister never said yes, but she wouldn't say no either.
I'm saying that all options are on the table. I'm saying that there is innovation and opportunities here in Ontario, and we will explore those.
Sylvia Jones says Ontario will continue to have a public health care system, but says her ministry is looking at unspecified options to improve it in light of the widespread worker shortages.
There are jurisdictions in other parts of Canada, in the world, that have other opportunities that we're going to look at. And all of those suggestions are being considered and studied by our ministry.
Emergency departments across Ontario have had to close their doors in recent months due to healthcare worker shortages. Just this weekend, ERs were closed at 2 hospitals in the Ottawa area and 1 in Grey County. The crisis was downplayed by Jones on Monday. Yesterday, the Ford government reintroduced its budget with no new money for health care, despite Doug Ford saying this today.
We're going to pour money into the healthcare system as we have.
Jones wouldn't say how long it will take to fix.
Innovation is, for me, a very important piece of how we can improve the system.
Well, that would be a disaster for Ontario.
Interim NDP leader Peter Tabuns says more privatization isn't the solution.
You know the reality. You look at the United States. Having privatized health care means much tougher lives for people and people not being able to afford the medication and procedures they need.
The Liberal Party's health critic says privatization should be a last resort.
Before we even think about looking at options like that, we need to make sure that our healthcare system is functioning the best that it can.
Worker shortages at hospitals in our region have caused long wait times and have impacted services, but so far no emergency departments have had to shut down. But with many healthcare facilities seeing large numbers of shortages, the possibility of more serious impacts is ever present.